Hi, everyone. I'm Jamie Yukas. Thanks so much for joining us. Health officials fear the Thanksgiving weekend could be a massive super spreader event that could overwhelm the hospital system. Coronavirus cases in the United States are continuing to hit record highs. More than 90,000 Americans are currently hospitalized from the virus. Nearly 18,000 of those hospitalizations are in intensive care units. Hospitals in some states, including Arizona, Colorado, Minnesota, and Pennsylvania, are all warning they could soon run out of ICU beds. Overall, nearly 13 million Americans have been infected with COVID-19, and more than 263,000 have died. Daily coronavirus deaths are now topping 2,000, a number not seen since the spring. Doctors and public health officials fear the nation could see another sharp increase in infections due to the holidays. Adriana Diaz has the latest.
I was worried after Halloween. I'm far more worried after Thanksgiving.
Hospitals are bracing for a post-holiday influx of COVID patients. Dr. Meeta Shah works in the ER at Chicago's Rush University Medical Center.
We will not get a reprieve because then Christmas comes and then New Year comes. So if we're just stacking surge upon surge upon surge, I am significantly worried about that.
The lobby at Rush has been transformed into a COVID triage area to make room in case there's a surge of patients in the coming days. And though a projected 50 million Americans still traveled for the holiday this weekend, outside Los Angeles, this bumper-to-bumper traffic wasn't for holiday travel. It was to pick up a Thanksgiving meal from a food bank.
So many people just appreciate being here, being able to get out.
In Northwest Indiana, volunteers rallied to keep a local tradition alive, turning a massive Thanksgiving feast for 1,500 into a drive-through celebration.
God, we lift up these families who are mourning the loss of their loved ones because of COVID.
For others, the holiday was a time to reflect on a difficult year. Members of a church in hard-hit South Dakota set up hundreds of empty chairs outside the state capitol, one for every South Dakotan who succumbed to the virus. And for the Spano family in Connecticut, dinner was tough without their brother and son, Daniel Spano, who's in the picture frame. He died from COVID earlier this year. Thanksgiving was his favorite holiday.
We're gonna video chat and, try to have some sense of normalcy, but no matter what we do, it's not gonna be the same.
Back in Chicago, like so many frontline workers, Dr. Shaw spent her Thanksgiving in the ER.
You step out of your front door and you're sad that you're leaving your family on a holiday. But when you walk into these doors, this is your work family. And right now, my work family is hurting.
And here's why Dr. Shah and so many others are concerned. According to the city's public health commissioner, one Chicagoan is diagnosed with the virus every minute. Adriana Diaz, CBS News, Chicago.
The numbers are just unbelievable. Dr. Shereef Elnahal joins me now. He's the president and CEO of University Hospital in Newark, New Jersey. He's also the former commissioner of the New Jersey Department of Health. And we should also note that he's a volunteer with the Biden-Harris transition team looking at how the Department of Veterans Affairs is run. Thank you so much for joining us today. We just heard in that piece how millions of Americans are traveling this week. Many want to continue traveling over the holiday season. And it's despite health officials urging people to stay home. Do we expect to see just an even greater surge out of this, Doctor?
I think we will, unfortunately, Jamie. And I do think that travel is much less this year than in prior years. We know that from some preliminary data. But the more folks travel, the more folks congregate for holidays and get around the dinner table for holidays like Thanksgiving and the nights after that, the more you're going to see spread of this virus. So we are preparing very diligently in our hospital for this. We know that despite the clear advice from all levels of government that some folks are going to do this, and we're already starting to see evidence of that, but we have to prepare. And as you saw, hospitalizations are starting to surge to a dangerous level in some points in the United States. Thankfully not in New Jersey yet, but we're certainly on the trajectory to get there.
Yeah, but there's so many places seeing just record numbers as you're talking right now. Currently hospitalized 90,000, currently in ICU more than 17,000. I know one group we've been talking about specifically with the holidays, college students. What precautions should they take as maybe they head back home, maybe they skip Thanksgiving, but they want to come home for Christmas, or they came home for Thanksgiving, they want to go back to campus?
Well, first thing, Jamie, is to make sure that you have all the information in front of you before you even decide to do that. Make sure you know what the virus looks like, where you're going. Make sure you look at yourself and ask yourself whether you have a chronic condition whereby getting the disease could cause a very bad outcome. And then think about the folks you're visiting. Think about how old they are. Think about what diseases they may have and what might happen if they get COVID-19. We know that COVID-19 causes much worse outcomes in folks with chronic disease, diabetes, heart disease, lung disease, and so many other conditions. And so make sure you think about traveling in the first place before you do. And if you do decide to travel, make sure you do take all of the precautions necessary. Stay 6 feet apart from everybody if you can. Make sure that you're wearing a mask at all times, and really try to avoid things like railings and elevator buttons, things that you might be tempted to press on or touch in an airport or a train station. And then make sure, of course, that you're wearing your mask at all times to minimize the chance of spread. But again, really ask yourself before you travel or even travel back whether you should be quarantining, whether you should wait until the virus abates, because this is a really serious pandemic and it's only getting worse and worse, as you mentioned.
Yeah, I know. It's a really good point, too, that you're making in terms of thinking about where you're going. I was looking at the numbers a couple months ago, and knowing I'm from Minnesota that it was going to get colder, I decided to go home in October. I'm now not going to go home for the holidays. So I think it is an important point that people, even though it's tough, that maybe you change your plans a little depending on where you're going, because obviously looking at the numbers in Minnesota now, too, very, very high. The CDC also projecting that there could be anywhere from 294,000 to 321,000 coronavirus deaths by December 19th, right before Christmas. What is concerning you at this particular point?
Well, what you mentioned is very concerning because we're seeing not only hospitalizations go up, but we're still continuing to see cases go up in an exponential fashion. And we know that cases lag hospitalizations by about 2 weeks. And unfortunately, deaths lag hospitalizations on average about 10 days. And so every single case increases the risk of another hospitalization and another death. And one thing to remember, Jamie, is that it's not just the risk of getting COVID-19, it's the risk you're posing for anyone who has health conditions that may need hospital care or health care during that time. Right now, our hospital is nearly full with patients who don't have COVID-19 in addition to those who do. And a lot of that is a result of folks who had to wait and defer their care when we had a situation where in the spring, we had almost every patient in our hospital with COVID-19. We had to retrofit parts of our hospital to be able to fit them. So this is really serious, and it imposes risks, again, not just on folks who are at risk of COVID-19, but for anybody who might need health care.
Well, that's people don't think about. If you get into a car accident, there's no bed. If you have a heart attack and there's no bed, you're not, what do you do? The CDC I want to talk to you about considering publishing new guidance that would reduce the recommended quarantine period from 14 to maybe 7, maybe 10 days. They're kind of fluctuating in there. For someone exposed to the virus, what do you make of that?
Well, what I know is that there's a lot of recent evidence that shows that the vast majority of people, after they're exposed to the virus, begin to get symptoms between 4 and 7 days after that exposure. And so that recommendation would be in line with the latest data, which is the most important thing to consider. But there are also other benefits, Jamie, if the quarantine period is found to be lower amount of time needed. The first is that compliance with quarantine requirements would go up. The lower the number of days, the higher the likelihood folks will even do it when you ask them to do it, which is very important. 14 days is a long time, and we know from contact tracing data that a lot of folks are even scared to talk to a contact tracer in the first place because they don't want to have to quarantine for that long, or they work and they don't want to have to miss work and they're afraid of losing their jobs. And so if something is evidence-based and there's public health data behind it, and it increases the number of people who are complying with those recommendations, everybody would be better off. So I was optimistic actually when I heard that that may be happening. But of course, we have to wait for that final decision from the CDC.
And really look at the data there. I do want to ask you, I feel like everyone is looking at a little bit of light at the end of the tunnel when it comes to the potential rollout of this vaccine. The FDA is expected to make a decision on Pfizer's emergency use request, it looks like in the next couple of weeks. What do you see as the greatest challenges to getting Americans vaccinated?
Well, the first thing I'll say, Jamie, is that the science has been extremely impressive to date. And the fact that we were able to create so many vaccine candidates that are viable and at least preliminarily effective in less than a year is really incredible. But that's only the first step. The most important hurdle we all have to be considering is adoption. The latest data on the number of people who are willing to take the vaccine, including healthcare workers, shows that between 50 and 60% of people only are willing to take the vaccine, even if it does get emergency use authorization and even if it is distributed. The other hurdle is, of course, the logistics behind a mass vaccination effort over 6 months. This will be like nothing we've ever attempted before in our healthcare system. In our region alone, we're going to be asked to vaccinate over 100,000 people in the city of Newark and surrounding towns, of course, with the help, direction, and assistance of the city and the county. But that is a massive number of people that will likely require very large vaccination sites that allow for social distancing and essentially function as assembly lines. But those things will only work, again, if people are willing to take the vaccine, and that requires really setting the tone with the community, approaching the community humbly, and trying to dispel conspiracy theories and disinformation about vaccines in general as much as we can, because this is really a life or death situation, as we've seen, and it's our best hope of getting to normal after this pandemic.
I know it was a big topic of conversation on the Thanksgiving Zoom yesterday. Many of my family members saying, I don't know that I want version 1.0. Maybe I'll wait till version 1.3 or somewhere in there. So I do think the buy-in is going to be a little tough. Dr. Shereef Elnahal, thank you so much for joining us.
Thank you.